Welcome! This training video is to provide guidance on the insertion of Comfortear Lacrisolve 180-day absorbable punctum plugs. After bringing the patient back to the exam lane, be sure that you perform a thorough exam and a complete history before you decide whether punctum plugs are needed, and also before you decide what type of punctum plug you're going to insert. Some of the questions you should ask these patients are: what time of day are they getting awareness of their contact lenses? When they're doing activities such as computer use or being outdoors, are their eyes varying with dry eye symptoms? Do they have any systemic illnesses or take any medications that could be contributing to dry eye symptoms? And have they found themselves resistant to dry eye treatments in the past? Patients who make good candidates for punctum plugs include patients with seasonal allergies, contact lens wearers, patients who are going in for minor surgical procedures, and also patients who have systemic illnesses that can contribute to dry eye. Be sure to explain your diagnosis and make your recommendation to your patient. Upon their agreement, always get an informed consent signed. I like Lacrisolve 180 absorbable punctum plugs because they are effective in the horizontal canalicula, they never touch the eye, they're comfortable to the patient when properly placed, and they don't fall out. In order to select the correct plug size, visually inspect the patient's punctum. The Comfortear Lacrisolve 180 absorbable punctum plugs are made of polydiaxanone. They come in a sterile pouch with 2 plugs per pouch, and each box contains a single pair of plugs. It doesn't irritate the tissue and has good strength and pliability until it dissolves. After removal from the sterile pouch, use a jeweler's type forceps to remove one of the plugs from between the grooves in the foam holder. Then guide the plug partially into the punctum and release the forceps. You can use the tip of the forceps to push the plug out of sight into the horizontal canaliculus, so it's positioned approximately 4 to 6 millimeters beneath the punctum. While not required, you can use a drop of a non-steroidal anti-inflammatory in the eye to make sure the patient does not have any discomfort following the procedure. After insertion is complete, give the patient a few moments to adjust to ensure that he or she is comfortable. Before sending them on their way, be sure to ask how their eyes are feeling. The patient should experience no discomfort with Lacrisolve 180 absorbable punctum plugs. It shouldn't even feel like they're there. Tell your patient if they do feel something to call your office, and that you'd like to see them back in 4 weeks to make sure the plugs are helping their dry eyes. I hope this video gives you the confidence to provide the Comfortear Lacrisolve 180 absorbable punctum plugs to those patients who will benefit from this dry eye treatment.